Greetings, everyone. Today we're going to talk about the skeletal system and, in particular, the muscular system. Some of the things you'll learn, or that I hope you will learn from this, are the functions of the muscles, and we'll talk about the muscles of the head and neck, thorax, back, abdomen, shoulder, arm, and lower extremity. The functions of the muscles are to provide internal and external movement, to provide stability of the joints, to maintain posture so that you can sit upright, to control body openings, and to generate heat, which will maintain your body temperature. I wanted to throw this in here to you because I think it's important, but there are three types of muscle tissue. Skeletal, which is voluntary because it contracts by conscious control. Smooth, which is involuntary. It's not under our control because the organs work automatically. And cardiac, which is involuntary too. It forms the walls of the heart and contracts to circulate the blood. For the purpose of this recording, we'll talk about skeletal. Some of the keywords that I would like for you to own in on. You'll see these throughout the presentation, and I'd like for you to know what they mean. Abduction means to move a body part away from the median plane. Adduction means to move a body part towards the median plane. Flexion, or you'll see flexes, which means to bend a body part. Extension, which means to straighten out a body part. And insert, which means attaches. Now we'll go to the orbicularis oculi. It encircles the eye and helps close the eye. The orbicularis oris, it encircles the lip and helps close the lip. You'll know this as the puckering of the lips or the kissing muscle. And also you see people on social media. For some reason, females, not males, I don't see many of them, but they take selfies and they often like to pucker their lips or take selfies in that way. I think they think it's pretty sexy or sophisticated or something, but that's the kissing muscle. Continue, we'll go to the zygomaticus. It originates at the zygomatic bone and draws the upper lip back and up. It inserts at the corner of the mouth. The levator angularis, it originates at the maxilla and raises the angle of the mouth. The depressor angularis, it originates at the mandible and draws the angle of the mouth down. The rasoris, it originates at the masseter muscle and draws the corner of the mouth backward, as in tension or false smiling. So if you want to give a fake smile, you know you're working with the rasoris muscle. The levator palpebra superioris, it originates at the sphenoid bone and raises the upper eyelid. The buccinator. This is your trumpeter's muscle. And it helps puff the cheeks out. So if imagine you're blowing a trumpet, that's the muscle you're using. The corrugator, it originates at the frontal bone and draws the eyebrows in and down. And it inserts at the skin of the eyebrow. Remember, inserts mean attaches. The procerus, it originates at the bridge of the nose and draws the skin of the forehead down. The levator labii superioris, it originates at the maxilla and raises the upper lip. The depressor labii inferioris, it originates at the mandible and draws the lower lip down. Your mentalis, it inserts at the skin of the chin, but it also originates at the mandible and it protrudes the lower lip. Your temporalis, it originates at the temporal bone, which you would guess, and closes the jaw. It attaches at the mandible. Your masseter originates at the zygomatic arch and closes the jaw. Your medial pterygoid originates at the sphenoid bone, which is that bat shape, and palatine, and your maxilla and helps in mastication, and also inserts at the mandible. Your lateral pterygoid. It originates at the sphenoid and also helps in mastication, just like your medial one. It also inserts at the mandible. Now this one here, your sternocleidomastoid. So let's pronounce it again, sternocleidomastoid. This is the distance between your lateral margins of the two muscles, and what you should know is that it is the widest part of the neck, and it serves as an anatomical guide for locating major blood vessels in the neck. And this is important for embalmers, so when you're trying to locate vessels, you know that you'll be starting at the sternocleidomastoid. It originates at the sternum clavicle and rotates and flexes the head. So the sternum and clavicle, and it helps rotate and flex the head. Bend, which means flexes, rotate, turn, twist. It then starts at the mastoid process of the temporal bone, which inserts again means attaches. Platysma, it originates at the clavicle and pectoralis muscle and pulls the lower lip down and back, as in a look of horror. So if you're looking like you're pretty intense or scared, this is what you're working with, and attaches at the mandible. Digastricus, it originates at the mandible and elevates the hyoid. Your omohyoid, it originates at the scapula and depresses the hyoid. And here you'll see some of the muscles of the neck. You'll see your frontalis, your orbicularis, or oculi, zygomaticus, buccinator, orbicularis, oris, platysma, trapezius, and all cranial, temporalis, occipital, masseter, sternocleidomastoid. Oh Lord, I keep messing this up. Sternocleidomastoid. ABCD terms. Now we'll muscles of the thorax. Pectoralis major. This is Latin for breast, and originates at the sternum and clavicle and flexes or bends and adducts the arm, moving the arm upper. So if you want to move your upper arm, you're working with your pectoralis major, and it attaches at the humerus. Your external intercostal, in intercostal, I want to let you know that this means between the ribs. So we're talking about the external one now, and it originates at the ribs and elevates the ribs in breathing. Also, the internal intercostal, it originates at the ribs and depresses the ribs in breathing. Both of the intercostals, they're between the ribs and they aid in breathing. Your diaphragm, which we all know that when you're singing, you have to breathe from your diaphragm. And if you touch your stomach around your belly button and you sit upright and you breathe from your diaphragm, you'll know that it goes in and out. You'll see it protrude in and out. And it helps draw air, so when you're singing, you want to breathe from your diaphragm. You're able to hold your notes at a steady pace. You're able to not vibrato and vibrato, as they call it. You're not able to move. You're getting consistent, and you're getting good air in your lungs. So your diaphragm, it originates at the sternum, your ribs, your vertebrae, and it increases the chest capacity for breathing. And here are your muscles of the thorax. I am a visual person, so I will provide photos at each point. The muscles of the back, there are two of them. Your trapezius, and it's Latin for trapezoid shape. It inserts at the clavicle and scapula, and it's basically your upper back. So if you're lifting weights and you want a straight back, you'll know that this part is in your upper back. Your latissimus dorsi is Latin for wide and back, and it extends and adducts the arm. It inserts at the humerus, and it's your lower back muscle. Your lower back muscle. See, your lower back muscle and your upper back. Muscles of the abdomen, there are 5. The rectus abdominis, it inserts at the 5th rib and originates at the pubic and flexes the trunk. It runs from the sternum and rib cage down to the pubic bone. Your external and internal obliques originate at the rib and compress the abdomen. And this originates at the iliac crest and compresses the abdomen. They both insert at the midline of the abdomen. Your transversus inserts at the midline of the abdomen as well, but it originates at the rib and vertebrae and compresses the abdomen. Your sos major serves as an anatomical guide in locating the external iliac artery and vein. So it's down there by your femur, flexes the thigh at your femur, and it inserts at the femur. So it's also good to know this when you're embalming. Sometimes you'll have distribution. It will be bad distribution when you are trying to embalm and get it down to all parts of the body. There are certain situations that will call you to have to inject different body parts independently. And this will be one time you'll have to do that if you're going through the femur, or if you have a child, a baby, an infant, you'll start at the femur because they're so small you can't go up by the clavicle or the sternocleidomastoid, the muscles of the abdomen. Muscles of the shoulder, deltoid, there are two of them. It originates at the clavicle and scapula and abducts the arm. It makes up the shoulder area for the most part. Your teres major, it serves at a point which the axillary artery terminates and becomes the brachial artery. If you'll recall from some of my previous presentations, your brachial is your arm. Your teres major, it's the movement of the upper arm. So again, we're talking about the upper arm. Here you are. Your upper arm, shoulder. Muscles of the arm, biceps brachii or brachii. This it helps flex the lower arm at the elbow. So again, bends and originates at the scapula, inserts at the radius. All right, now let's go to the radius. Remember previous presentation, your radius, if you're looking at your hand and you see your thumb, if you just go downward, your radius is right there. Remember, they take that pulse, that's your radius. The brachialis originates at the humerus and flexes down to the lower arm at the elbow. And it inserts, attaches at the ulna, which is opposite side of the radius. Triceps brachii, it originates at the scapula and humerus, extends the lower arm, extends it to the elbow joint, and inserts again at the ulna. So triceps brachii and the brachialis, they both attach at the ulna, and the biceps brachii attach at the radius. And here you are. If you look here, your thumb, as I was saying, your radius and your ulna. Of the lower extremity, there are 13 of them, and at this point you know that we are almost done. Your gluteus maximus. Now I won't even read all of this because we all know this as your butt or your buttocks. Your buttocks. And it inserts, attaches at the femur. Your adductor longus, which I will refer to as point A, and your magnus is point B. Your adductor longus originates at the pubis, and the magnus, it originates at the ischium and pubis. Both of them, they adduct the thigh, and they serve as the point at which the femoral or artery terminates and become the popliteal. This is the magnus. Both of them attach at the femur. So again, the adductor longus and magnum, they attach at the femur, and they adduct the thigh. The sartorius, which is Latin for talar, originates at the iliac spine and medial tibia, and it also flexes and rotates the leg. Now we have the rectus femoris, the vastus lateralis, medialis, and intermedius. They originate at the ilium, the rectus femoris does, and the vastus lateralis, medialis, and intermedius, they originate at the femur. Both of them extend the lower leg and attach at the tibia. Biceps femoris inserts at the fibula or attached there, and originate at the ischium and femur and flexes the lower leg. So again, a lower leg. The semitendinous and semimembranous, they both attach at the tibia and originate at the ischium and flex the lower leg. So again, we're talking about lower extremities, the lower leg now. Now the popliteus, it originates at the iliac spine and medial tibia, and it flexes and rotates the leg. Tibialis anterior originates at the upper tibia and flexes the foot. And you think about this one, just flex the foot and inserts at the ankle area. So at your ankle and flex the foot, your tibialis anterior. If you just move your foot around, sometimes we have to do that when our foot falls asleep. Or if you want to get a good workout, you want to stretch your lower leg, your trainers will often tell you to flex them and hold them up instead of point your toe. Gives you a good old stretch. The gastrocnemius is Greek for belly of the leg and originates at the femur and extends the foot. It allows you to stand on your toes. Stand on your toes, and inserts at the calcaneus, which is the heel bone. So now let's talk about this during a workout. If you are standing on your toes, your calf muscle will just enlarge throughout time, and when you walk, women in heels, they are looking at that calf muscle and they know you work out. They particularly stand out with track runners, those who run track. Your soleus, Latin for flat. It originates at the tibia and fibula and extends the foot and allows you, again, to stand on your toes. And they attach at the calcaneus heel bone. So talk about the picture here, your muscles of your lower extremity, buttocks, gluteus maximus, biceps, adductor magnus, semimembranous, semitendinous, tibialis, flexor, soleus. This is that calf muscle. Good stretching. And at this point, we have concluded our video and presentation. I hope you have enjoyed it.